Hi, Dr. Minkoff, LifeWorks Wellness Center. With aging in both men and women, we're just going to talk about men today because this is Men's Health Month, is this thing called low T. You see it all over the television sets. Low testosterone in men as they age is a problem in our society. And there used to be an ad for Cialis, which was an ED drug, where a New York Yankees home run big time hitter at age 34, 35 was doing a promotional video for Cialis. Now that's kind of weak, you know, like the hero doesn't have T either and needs a drug to get it up. Now I think they run that ad because there are so many men who do have low testosterone that in fact LabCorp a year ago changed what the normals were for testosterone. It used to be that for men, say 40 to 50 years old, the testosterone levels on their lab tests ran from about 370 or 390 to 1200. And if you were in that range, you were considered normal. Because the way they get these normals is they test hundreds of thousands of people and they see where does it lie. There's a bell curve. There's of the 100%, half are sort of in the middle, and then some people are lower, 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 and some people are higher, higher, higher. And what they do is they take 5% off the bottom and 5% off the top. They call that normal, and so it was 390 to 1200. And just a year ago, because the averages were lower than that, they now changed the lower range to, I think, 230 and the higher range to 900. Now, did the human body physiology actually change? Are the normals now actually these lower normals? No. We know that my father, so these are people who were born in the early 1900s, had levels of testosterone that were at least 30 to 50% higher than what we are carrying today. This is an environmental problem. There's so many toxins in the environment and probably so many stressors that testosterone levels have gone down, 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 down. Fertility rates in men have gone down. Sperm counts have gone down. Sperm motility has gone down as a result of body toxicity. It's the only way to explain it. It's not genetic. This is across the board, virtually all Western cultures. Okay? Now, men with a testosterone level of 350, which is in normal, don't feel like men very much. Especially if when they were younger, their level was 600, 700, 800, 900. I just heard that Shaq O'Neal's testosterone level without taking any is like 1800, okay? So the men that are the most competitive, that are most successful, that are the most physically well developed have high testosterone levels. And men who had that and are low don't feel good. They get body fat, they lose their drive, their sleep isn't good, their emotions aren't good. They get depressed. They go to the gym and work out and they can't make muscle. And this is a real problem. And they can't get an erection. So Viagra and Cialis and these other drugs sell in the billions because there really is a problem for men and it really needs to be addressed. So if you're out there and you have one of these, you are like this, the only way that you know where you are is you go get a testosterone level, estrogen, DHEA, progesterone, dihydrotestosterone. These are a panel of tests that we do to look at hormonal health. Some men are turning their testosterone into estrogen. And that's a very common thing. So as a man ages, his testosterone goes from 700 to 300, and his estrogen goes from low to high. And there are many men who are 50 who walk around and their levels of estrogen are higher than their wives. And in women, the same thing. You see, as women age, they get whiskers, they get hair, they get deep voices, they start to look masculine. It's because they're converting their estrogen to testosterone. So the opposite process occurs in females. So you have guys with low testosterone, and they get man boobs, and they accumulate body fat, and they lose their drive, and they cry at movies. So this needs to be fixed, and the way it can be fixed is first we have to see what is the cause of it, what are the toxicities, is it heavy metals, is it deficiencies of boron and selenium and some of these other things, are they on a cholesterol suppressive drug? Testosterone is made out of cholesterol. I saw someone yesterday who the cardiologist had put on a cholesterol drug and a statin drug, and his total cholesterol, which ought to be around 150 to 250, say, that's the average normal range. His total cholesterol was 88. And I said, I saw the lab test, and I said, well, what'd your cardiologist think about that? And he said, it's perfect. Now that guy's going to not make testosterone. He's going to deteriorate his brain. He's already got aches and pains. It's drug toxicity, okay? So many men that are on statin drugs, it may push their testosterone level down and they don't feel good. So depending on what the problem is, we can get the overall health better so that the body will start making testosterone. Or we can supplement with bioidentical testosterone. Sometimes we can't get it up, but the guy doesn't feel well without testosterone. And so the bioidentical testosterone is the same exact hormone that's made by the body. It is very good. It helps people. They feel better. They can get erections. Their sex drive comes back. They can build muscle. Their depression goes away. They lose body fat. And there's no side effects to it if it's managed well, and it really can help. So what I suggest is if you have this problem, if ED or low hormones, or you're not feeling yourself, that you come in and get evaluated, because these are things that can be corrected. You can improve your health, you can feel way better, and you can get your swagger back. Okay? Hope this helps.